All right, got a medical emergency, and we all do. We panic sometimes. We don't know what to do. It's like, what do I do? Should I call 911? How serious is this? And can you get someone to the hospital quickly enough? These are all the things that rush through our mind. So we have answers because we got a doctor in the house. 9 News medical expert Dr. Comilla Sasson joins us now with some medical treatments that we actually have in our home and maybe something we can do in case of emergency, become our own MacGyver.
Yes, indeed, right?
We got to hear the music. Yeah, I know. Okay, so we're going to walk through some of the basic things. Knocking out a tooth happens all the time.
Yes, absolutely.
So,
and we see it all the time in the emergency department. And I always think there's a few things that you can do that could save your tooth, which is so important. A lot of folks don't realize
save the tooth, don't trash it.
Yeah, so save the tooth. And what you do is you wash it off very gently and then put it right back in the socket if you can. Or if you can't put it back in the socket, you can actually put it in a glass of milk.
Oh, really?
And then transport it, bring it with you to the emergency department, ideally to your dentist, because your dentist is the one that can actually reimplant it. But make sure you keep it. Lots of folks that don't.
Did not know that.
Yes.
Okay, and milk.
And milk, right? Who knew?
Who knew? Okay. Laceration, especially something on the head, when you have a big cut in the head, that's something a lot of people really panic over. What should we do?
Yeah, so you normally will get staples put in if you have a big scalp laceration. Right. But if you have a smaller scalp laceration, or if you're deathly afraid of syringes, you can actually do this really interesting, it's called a hair apposition technique. Basically what you do is you take 5 strands of hair on one side of the wound, 5 strands of hair on the other side, turn it around in a 360-degree angle, put a little bit of skin tissue adhesive, and do it all the way down the laceration. Can't do it for all of them, but potentially an option, especially if you have kids that knock their head.
Okay.
And I did this actually in a neighbor's house in my neighborhood. Just a few months ago. So it works.
Yeah, I think I'd rather have you doing it. A basic braid isn't really my forte, but okay.
Another option.
All right,
yeah.
That's important. Okay, a dirty wound. I mean, so oftentimes kids, especially, they're outside when they have something that they fall or cut their knees or something, and then it's all nasty, and then they're screaming and crying. They don't want you to do anything.
Right, and most of the time people think you have to use sterile wash, like a sterile saline. This is actually one that you can find at a grocery store, Walgreens, CVS, but you don't even need it. You can just use tap water. So as long as it's high pressure irrigation, you're cleaning out all of that dirty debris.
Soap, nothing else.
Yeah, just high pressure water in that wound, and it's actually been shown to be just as effective as saline.
Good old water.
Good old water, but make sure you clean it really well.
Okay, dental bleeding. A lot of folks have that happen too sometimes, and they can't get it to stop.
Yeah, so a tea bag, a black or green tea bag can actually be used. And so what you do is you wet it, moisten it, put it right where that bleeding is happening, and hold pressure for about 30 minutes. Most of the time it will stop now. Obviously, if you're on blood thinners, it may not, so you have to talk to your dentist. But there's tannins in here that actually can constrict the blood vessels.
Oh, and you know what? These things never happen during regular business hours when you want to see the dentist anyway, so this is an important thing to know. Okay, perhaps maybe you went out and got a little too crazy, a big night of drinking. Any kind of cure you got for us on that?
We do.
Okay.
So there's actually studies. There's studies. People do research on this. I know, it's amazing. Isopropyl alcohol. So this is something that's available over the counter. Use it most of the time for cleaning out wounds, but it actually, there's data to show that it's just as effective as our medications. You put it on an alcohol swab and sniff it for 5 to 10 minutes, and it can be just as effective for mild or moderate nausea.
Oh, and a lot of times people are just nauseous for other reasons.
Yeah,
so
I was nauseous constantly during pregnancy, right?
As
well, too. So not for vomiting, crazy,
no, but nausea is just a miserable feeling.
Yeah.
Okay.
So over the counter available.